Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a Corpuscle Quake, Corpuscle Quake edition. This audio podcast is part of a Quake and Storm, this audio podcast as part of a Bostics Quake, and this audio podcast as part of a Storm Robotics production. This audio podcast, a little bit around the advantages in around early CKD detection. In around the advantages around early CKD detection. Some conditions are functionally self-limiting, whilst others may progress so slowly that there is sufficient renal function for a patient or recipient to live out a normal lifespan. Even when the kidneys begin to fail, careful control and timely intervention to prevent complications can enable a person to survive in good health for many years. To support more effective modalities of monitoring CKD, scientists and community pharmacists could or should be encouraged to implement POCT in the community. Community pharmacists should also be encouraged to conduct or carry out MURs or medicine use reviews services to assess the broader community, to assess the sort of varying drug use, and where certain drugs or specific drugs can lead to nephrotoxic side effects. So implementing an enhanced POCT or point of care testing service that enables suspect or high risk patients to be screened in community, in addition to an MUR service or medicine use review service, can help in one, early detection and prevention of CKD, two, potentially spread the workload of general practitioners, for example, and three, to prevent late referrals to secondary care, four, to sort of tighten control of specific regimens with implementation of an MUR service, medicine use review service. Number five, to allow sort of a broader availability, broader service availability in primary care, and six, to sort of strengthen renal care according to guidelines. And so, for example, retrospective guidelines, the national where in around specific or retrospective guidelines, such as the National Service Framework for Renal Services, and amongst other sort of more recent guidelines, and ultimately early detection and proactive care, or POCT, in sort of pre-dialysis patient communities, or communities will not only improve sort of the well-being, but should enable sort of savings in around the National Health Service. That draws this audio podcast to a close. An audio podcast as part of the Corpuscle Quake edition, an audio podcast as part of a Quake and Storm, an audio podcast as part of a Bostics Quake, an audio podcast as part of a Storm Robotics production.